For the same reason, I won't delay any further. We'll go straight to our opening remarks from Jean-Luc Lamailloux, Director of the Division for Policy Analysis and Public Affairs at UNODC.
Thank you very much, Fiona, and thank you very much for having me here. It's nice to see you all back. Colleagues, friends, friends of HIV/AIDS as well. And I have to say to you, you took half of my speech away by introducing everybody. I mean, I wanted to do that. I mean, that was my 5 minutes, but glad that is over. So let me just thank the group of friends of UNODC HIV/AIDS, the section, the Thailand Department of Corrections, and of course, Penal Reform International. Sadet, always good to see you here. And the International Drug Policy Consortium, who is here in person, who I'm trying to look around to see if I see that familiar face. Anyhow, working together on this. So as you can see, I mean, on the invite there at the bottom, there's quite some flags and all kinds of symbols there. And it really indicates how interesting this topic is for many of us. It's really, really timely. It's really something which we need to take care of. And let me try to introduce you some of the problematics which we have. As we do know, people in prison are a key population among those that are particularly vulnerable to HIV. Yet, we do know that as well, very often, even the basic necessary healthcare services are just not available. And if you look at the figures, the estimated prevalence of HIV infection among people in prisons and other closed settings is currently 4.3%. 4.3%. Now, to give it a bit of magnitude, that's about 6 times more than adults in the general population. And if you break down that figure, I mean, it comes even more dramatic and scary. Women, we do know, represent a minority of the prison population, but they are more likely to live with HIV than men in prison and women in the wider community, of course. Data from the Global AIDS Monitoring System in 2020 show that average HIV prevalence among women in prison was 5.2%. So 5.2% compared with the 2.9% among men. And still drilling a bit more closer, when we look at transgender people, UNAIDS reports that they are 13 times more likely to acquire HIV than other populations. Almost 20% of transgender women around the world are living with HIV. Now, we do know that those figures, of course, are incomplete. I mean, very few countries report on transgender people and HIV in prisons. And the 4 that did so indicate an HIV prevalence of 55%. Now, that's shocking. Now, many factors related to this, I mean, including stigma and discrimination, hindering women and transgender people from accessing existing prison healthcare programs and interventions, in case those already would be available or would be adequately implemented. And often, if they are available and adequately implemented, they would not take into account gender-specific healthcare needs, including sexual and reproductive health. Hence, reducing inequalities and enhancing access to prevention and treatment services for women and transgender people in prisons can only be achieved with specific measures, including comprehensive sexual and reproductive health care and sustained continuity of care throughout the criminal justice system, not only the prison setting, but throughout the criminal justice system. In response to the urgent need of women in prison for gender-responsive services to prevent infection with HIV and transmission to their infants, the Commission on Crime Prevention and Criminal Justice adopted a resolution which is called Ensuring Access to Measures for the Prevention of Mother-to-Child Transmission of HIV in Prisons. And following this resolution, my organization, UNODC, together with relevant co-sponsoring agencies sitting here with us today, in 2020 published a technical guidance document on implementing measures to prevent vertical transmission of HIV in prisons. And more recently, we as well made available a dedicated monitoring tool to track related epidemiological data and service coverage in prison settings. In 2022, last year, UNHCR partners developed a technical brief on transgender people and HIV in prison. And this brief promotes human rights-based approaches for the population of transgenders and the right to prison programs that are responsive specifically to their needs, in line with the United Nations Standard Minimum Rules for the treatment of prisoners, better known as the Nelson Mandela Rules. We are nearly there, as we heard from the President of the General Assembly, to 2030, and honestly speaking, it's rather sobering to see the little progress we have made, especially as well if we think and take into consideration that by 2030 we should have ended, or we hope to have ended, the AIDS epidemic as a public health threat. Now, we need to do more, and we need to do more faster to achieve this ambitious target, and that demands an integrated approach with a focus on key populations, including the people in prisons, leaving no one behind. With this, Nona, thank you very much, and more than happy to hear what other speakers will tell. Thank you.
Thank you very much, and I think this perfectly sets the scene and the context for today's discussion and reminds us of the urgency of action in this area. So we'll go next to our first panelist, Zavid Mahmood from the Office of the High Commissioner for Human Rights, to speak about the impact of over-incarceration on women's right to health.
Thank you, Trina, and also welcome to all other partners. OSCE Chair is really happy to co-organize this event with UNODC, PRI, and a large number of countries. I'm not going to also mention all of you, but we are really happy to co-organize this event. As mentioned by already Jean-Luc, different data has been provided. I would like to start my intervention also providing some data. Around 1,200 million people are detained globally, with an observed rise in the female prison population in recent years. The recent data published by Birkbeck University shows that more than 740,000 women and girls are held in prison institutions throughout the world, either as a pre-trial detainee or having been convicted or sentenced. These data also reveal a much faster growth in female than male prison population since the year 2000. While number of women and girls in prison has grown almost 60%, the male prison population increased by around 22%. These figures are incomplete. Due to crisis, war, conflict, as well as some government policy not to share data, it is hard to determine exact number of prison population and disaggregated data based on sex, gender, and sexual orientation and other status. The actual total is therefore higher. Though women represent minority in the global prison population, they are disproportionately affected by lower socioeconomic status, exposure to interpersonal violence, custodial violence, and mental illness, and often belonging to identified vulnerable groups. They are sexual minorities, victims of sexual abuse, trafficking, and drug-related crime, those with psychotic illness or learning disability and drug dependence. In many countries, women prisoners, like others, are incarcerated in overcrowded prisons and detention centers, which have negative impact on the prison condition, including in the area of health. A range of human rights treaties protect the right of the prisoners, including the right to health. This year, we celebrate 75th anniversary of the Universal Declaration of Human Rights. This milestone celebration provides us an opportunity to rekindle the spirit, impulse, and vitality of the UDHR and renew a worldwide consensus on human rights, including in the area of crime prevention and criminal justice. The Universal Declaration of Human Rights provides for the right to health in Article 25. This right recognized under the declaration are further elaborated by the International Covenant on Civil and Political Rights, International Covenant on Economic, Social, Cultural Rights, and other human rights treaties. While International Covenant on Civil and Political Rights does not explicitly provide for a right to health, it specifically provides the right to human treatment of prisoners. Article 10 of the Covenant imposes on state parties a positive obligation towards persons who are particularly vulnerable because of their status as persons deprived of liberty, and complement of them the ban on torture or other inhuman or degrading treatment or punishment contained in Article 7 of the Covenant. Thus, not only may person deprived of liberty not to be subject to the ill treatment, it is also neither subject to be any hardship or constraint other than the resulting from their deprivation of liberty. Respect for the dignity of such person must be guaranteed under the same condition as for a free person. This issue of the dignity led me to discuss about the right to life, the right to health. International Covenant on Economic, Social, Cultural Rights is most important in terms of recognizing the safeguards the right to health. State parties are obliged to recognize the right of all to the enjoyment of highest attainable standard of physical and mental health. The committee which monitored this treaty, Committee on Economic, Social, Cultural Rights, explicitly stated that states are under obligation to respect the right to health by inter alia, refraining from denying or limiting equal access for all persons, including persons or detainees. All the International Covenant on Economic, Social, Cultural Rights recognize the progressive realization of such rights and acknowledge resource constraints faced by state parties. However, under the Covenant, states are obliged to take deliberate and concrete and targeted steps to realize the right to health and to identify indicators and benchmark of track its progress. The unique gender aspect and rights, including the right to gender appropriate and gender sensitive, gender responsive healthcare of women, is further recognized in the Convention, UN Convention on the Elimination of All Forms of Discrimination Against Women. Article 12 of CEDAW requires that state parties shall take all appropriate measures to eliminate discrimination against women in the field of healthcare. This convention provides that discrimination against women encompasses ill treatment that affects women disproportionately, including detention conditions that do not respond adequately to the specific needs of women, including in the area of health. With regard to children, I would like to refer to the Convention of the Right of the Child, which also discusses about the children detained in the prison, and the healthcare and medical care to young detained persons should be centered on the principle of the best interest of the child. Let me reflect on the Convention Against Torture and other cruel, inhuman, and degrading treatment and punishment. The convention has provide binding obligation on the state not to treat those deprived of liberty and recognize, not to ill-treat those deprived of liberty, and recognize that an adequate level of healthcare can lead rapidly to situation, an inadequate level of healthcare can lead rapidly to situation falling within the scope of the term inhuman and degrading treatment. And obviously, we have Nelson Mandela rules and Bangkok rules, which further elaborated the right of the person of liberty. I would like to also refer to United Nations Principle of Medical Ethics, WHO and World Medical Association Declaration on all mandate related to the right of the prisoners to human treatment and appropriate medical care. Let me briefly highlight the findings and recommendation of the human rights treaty bodies, or human rights treaty bodies, as well as the UN special mandate holders who monitor the different human rights treaties. Our office field presences in many countries around the world also monitor the human rights situation in prison and assist national authorities in improving prison conditions. Our recent research, which examined the concluding observation of two human rights treaty bodies, CEDAW, which monitored the Convention on the Elimination of Discrimination Against Women, and the CAT, the Convention Against Torture. And in this research, look at the findings and recommendation of these two committees since the adoption of the Bangkok Rules. In this research, it was found that continued lack of the implementation of Bangkok Rules in a large number of countries regarding the right to health of women in detention setting. This research found that the various areas with regard to right to health, let me highlight a few areas here. The right to adequate accommodation relate to the clean water, food, and hygiene. Right to gender-specific healthcare services, at least equivalent to those available in the community, which is related to the Bangkok Rules number 10. The comprehensive health screening of women and relevant responses to providing medical care for HIV and AIDS and reproductive health. Individual gender-specific trauma-informed and comprehensive mental health care and rehabilitation program. Drug dependency treatment, as well as lack of basic needs provision, neglect of hygiene needs, insufficient privacy of sanitary facilities, and unsafe, deplorable, unsafe and other services. While examining the state party report and also during the country visit, which is done by the subcommittee on the torture, subcommittee against torture, they found that there are often no female health professional available to provide adequate care, follow-up, and other services. In some instances, female doctors visit prisoners between once a week or once a month to provide women inmates with health care, which is not enough. Also, let me highlight just a few issues with regard to transgender and trans women in the detention places. Our office found that trans women in detention face particular risks of violence, harassment, and discrimination, and they often do not receive adequate healthcare services, including hormone therapy or gender-affirming care. In the conclusion, I would like to reflect one issue which is related to the prison condition, that is prison overcrowding. In the UN Common Position on Incarceration, the UN system pledges to support reform effort aimed at ensuring proportionate and individualized sentencing policy and alternative to convention and punishment in appropriate cases, including for minor drug-related offenses. It will equally advocate for the decriminalization of acts that are protected, such as possession of drugs for personal use. One of the key factors of increased incarceration of women is the overly punitive drug policy, which fails to take the consideration of the specific situation of women. With that, I would like to conclude my statement that we are promoting the decriminalization of personal use of drugs, which will help to reduce the prison population as well as improve the condition of the prison, including in the area of health. Thank you.
Thank you, Zabet. I think that's a really important reminder for all of us on the basic rights of everyone in prison and in detention, and also the obligation on state to provide healthcare that's at least equivalent to that in the community, and that perhaps the most effective way to improve healthcare in detention is to have fewer people in detention and reduce the overuse of imprisonment. So we'll move now to our next speaker, Vichabud Suprapat, the Director of Foreign Affairs Subdivision from the Department of Corrections in Thailand, who will share the national experience.
I would like to thank the UNODC for inviting us to co-sponsor this important event. I'm here today to tell you of how Thailand addressed the health needs in our prisons by employing the gender perspective. Next slide, please. Sorry for the trouble.
It's okay, you're in control now.
Not really. Can we do it from the computer?
Yes.
The laptop? Yeah, exactly.
I can do it.
Okay, then.
Right, I would like to acknowledge here that considering the implication of the topic of gender intertwined with incarcerated space has pushed our service to a new territory of treatment of prisoners and also prison management. Since the Bangkok Rules was adopted by the UNGA in 2010, Thailand has committed to responding to the gender-specific needs of women in prison system. Next slide, please. The Thai prison system has been facing the challenge of overcrowding for more than a decade. But the number of prisoners is significantly dropped due to a number of reasons, including royal pardons, the new narcotic acts, legalization of cannabis, and the early release program that include parole and good time allowance. Our inmates, around 77% are drug-related offences. And the current staff capacity is roughly 1 to 22. Next slide, please. And the gender gap in prisons refer to the disparity between incarceration rates of male and female. Men makes up the majority of our prison population in Thailand. It could be said that the Thai prison system is designed to deal with male prisoners. However, our efforts also focus on providing gender-specific rehabilitation and support programs tailored to the unique needs of other individuals, not only female inmates, but also the group of LGBTIQ+ as well. Next slide, please. Regarding the healthcare policy in Thai prison system, the Department of Correction of Thailand acknowledged the principle of law, rules and regulations, and also standard and norms as a framework in building up the healthcare service delivery in the Thai prison system. Next slide, please. And Department of Correction of Thailand is building up our team of medical professionals and investing in equipping our own prison hospital and also prison infirmaries. Next slide, please. What I need to acknowledge here is we could not have done it without a strong partnership with Ministry of Public Health, National Health Security Office, Global Fund, UNDP, and with high regards, UNODC. This group of key partnership has a similar vision in looking after the vulnerable. And our royal family, especially our king, also plays a key role in investing both medical equipment and healthcare facilities. This cooperation allows Thai Correctional Service to be able to address more efficiently in providing healthcare service to each individual. Next slide, please. As I firstly described and at the opening of the presentation, since the Bangkok Rules was adopted in 2010, Thailand has committed to responding to the gender-specific needs of women in prison. In 2013, Thai Department of Corrections launched the project to start implementing and integrating Bangkok Rules in our 8 female-specific institutions and more than 100 female blocks within the male prisons. Since then, we utilize gender-responsive approach in facilities improvement and female inmates living condition. We also attempt to upgrade health service delivery and accessibility by considering women's health aspect. We have also taken into account the complexities of mother and children in prison by providing them dedicated spaces for mother and their babies. These children can stay with their mothers for up to 3 years in the prisons. However, we try our best to partner with the family and also other social support services to take the babies and look after them while their mother is in prisons. Knowledge to be a mother is very important too, as we equip them with parenting and babysitting skills. Next slide, please. In terms of addressing health needs in LGBTIQ+ inmates, the Thai Department of Corrections upholds the principle of safety, well-being, respect, and prison security. This year, we issued the standard operating procedures for transgender inmates, which highlights how prison officers should deal with spaces, the expression, gender sensitivity idea that intertwine with mental health issues. More importantly, how we provide access and continuity of gender-affirming care in prison. Past experience, Thailand has once used the segregation measure and established a pilot prison section in one of our facilities in 2018, as we concerned about inmates' specific needs and their security. However, this pilot project was stopped due to the inmates' feeling of exclusion and discrimination. At this very moment, we are still trying to find the best possible way to deal with the intersection of prisons' cisgender space and the range of specific requirements due to their health needs and their living situation. Next slide, please. As described, we have tried our best in delivering the health needs to prisoners by considering the gender specific aspect. However, we have found many challenges, including the segregation or living with others, space and requirement in a very limited space and resources, access to gender affirming care, which at the moment we allow only when they obtain a medical certificate from medical professional, and they need to pay at their own cost. Lastly, staff inadequate understanding about the gender sensitivity and their specific needs. To conclude, we might not be able to recommend anything. What we might be able to say is working toward addressing the health needs require a collaborative approach as well as public health understanding. And thank you very much for your kind attention.
Thank you.
Thank you very much, Richard. I think even if you don't call them recommendations, I think we can find some recommendations in what you've presented to us.
Yeah.
So it's great food for thought and reforms that I'm sure could be useful elsewhere as well. Our next speaker is online, Rosma Carolina from Women's Voice Indonesia. Rosma spent 18 months in prison in Indonesia and has since been involved in advocacy for people who use drugs that are in contact with the criminal justice system. She'll be speaking today about gender-based barriers to health services in prison. So please, Rosma, the floor is yours.
Thank you. Everyone, my name is Rosma Carolina from Suara Perempuan Inkarnasi Nusantara, or known as Women's Voice. Next, please. Okay, I'm talking about Indonesian situation based on our experience. Considering related drug for incarcerated women, accessibility only in the prison specific for women, while in the general setting are not available yet. And distribution of sanitary pad not implemented in all prisons. Some use pad and other using tampon. Unsuitable distribution. We have testimony from several incarcerated women. We only get forfeit for 1 month. And also mother and child health service are not available in many prisons. The need to childcare and face significant difficulties starting from the process of give birth, breastfeeding until fulfilling their immunization. Lack of nutrition for pregnant women and breast milk substitute they have to buy by herself. Prison not accommodate the OST for incarcerated women. Drug use is closely related to mental health, whether drug as cause of mental health is the cause of drug use. Mental health treatment are not available because the medicine mostly considered as psychotropical drug. Basically, ART provided by government for free of charge, but some prison in the incarcerated women want to access unofficially staff in the prison charge quite amount of money to procure and collect the RT. Sexual and reproductive health information not routinely provided. Next, please. If we are talking about HR component that must be available anywhere. Incarcerated women have equal rights, including their right for freedom from gender-based violence, HIV/AIDS, STI prevention and treatment, contraception, maternity health, clean water sanitation, baby care up to 2 years old, menstrual, pregnant, and lactating women care, safe abortion and post-abortion care, infertility service, cervical cancer treatment, drug addiction treatment, including OST, methadone, mental health, and elderly care. HR need problem related can be addressed through policy. We have the challenge, the policy, health service, information, education, and communication, counseling, monitoring, and evaluation. If we are talking about incarcerated women, the state is only limited our freedom, but not other our right. Next, please. We have challenge here. The guarantee for the security of health service for incarcerated women can be in the form of policy permit, health worker permit, medicine according to medical standard, no malpractice, and secrecy for the prisoner's medical record. In practice, the health service provided to incarcerated women and men are not much different, but women have special privileges that are not owned by men. These special privileges include the menstrual cycle, pregnancy, gave birth, and breastfeeding as human nature as a women. One, lack of awareness by incarcerated women of the importance of health service, such as not taking the drug right on schedule. Two, limited medical personnel, inadequate treatment room facility, and lack of facility and infrastructures. Lack of budget of medicines. There are many infection diseases in prison, such as tuberculosis and skin disease, because the overcrowded of prison and ventilation is inadequate. There are still incarcerated persons who are not registered or as a BPJS. BPJS is health insurance covered by state, and referral process to the hospital cannot done quickly because the prison must notify the depository institution, especially in the point 6. If a woman about to give birth and complication occur, this cannot be done quickly because herself must notify the caretaker institution. Next, please. So we have recommendation. Promote sensitization and awareness raising, targeting police service provider, staff of correctional institution and rehabilitation center regarding gender issue and right faced by women who use drugs. Make sure every case of violence, including gender-based violence, is reported and follow up, provide and profit referral to comprehensive post-violence support and care service for women who experience it. Provide women special room and or hour at harm reduction service location or institution or class setting. Work with women who have experienced violence or survivor to form a client lead mitigation strategy and have security plan. Provide training and sensitization about rights, including gender-based violence to incarcerated women. Build partnership with legal aid service and other human rights organizations. Build partnership with providers of safe house or shelter for women who use drugs and their children. Provide training and support to staff or shelter that currently do not accept women who use drugs to change their policy. Advocate for the closure of forced rehabilitation and care institutions according to joint statement by United Nations Agency on Drug and Rehabilitation Detention Center. Next, please. And we also have recommendation, advocate for the adoption WHO guideline for package HIV prevention and treatment service for those who use drugs with adequate coverage. involve meaningful women who use drugs, including trans women, in the preparation, implementation, and supervision of harm reduction program and service in closed setting. Provide information about the transmissions of HIV and STI symptom, and the promotion of safe sex and drug use, including counseling and empowerment strategy of negotiating safe sex and drug use. A sensitive approach is needed in testing, diagnosis, and treatment service, including HIV and STI care and support. Provide menstrual service that focus on women's health. Harm reduction service staff need to understand the link between drug use and sexual behavior, if any, so they can provide accurate information to the incarcerated person. Provide counseling to incarcerated women using multiple protection strategy to prevent transmission of HIV, STI, HPV, and unplanned pregnancy. Multiple protection strategy can include provide male and female condom, including lubricant, use of condom and other form of birth control, emergency contraception if condom fail, and other contraceptive method. And the other recommendation is, if the state do not provide our right in the prison, please do decriminalization and or alternative imprisonment or rehab. Thank you.
Thank you very much, Rosma. Very clear challenges and also very clear recommendations for ways forward. So just a quick reminder for anyone online to post any questions in the chat or in the Q&A box, and we'll hopefully have a couple of minutes at the end to come back to any of the speakers. So we'll move now from Indonesia to South Africa. Our next speaker is Tebogo Makburi, member of Just Detention International South Africa's Survivor Council, a self-taught makeup artist, feminist, and queer rights activist, and also a survivor of sexual abuse in detention, who has been collaborating with Just Detention International for over a year to highlight abuses of trans people in detention. So please, the floor is yours. You're on mute, Tebogo.
Okay, sorry about that. Good afternoon, everyone. And my name is Tebogo, and I'm honored to be a part of the space. Having been in detention as a trans woman in police detention center, I got to experience some of the actually overwhelming experiences. And with regards in custody, with regards to my health needs, prior being sexually violated, raped, I would actually say that I did not come forward addressing the incident that actually happened. And for, I feel like there was some sort of measures that could have been put in place, especially with regards to trans women being actually exposed to higher risks than any other individual in incarceration. So I feel like there could have been some sort of checks, health checks or medical checks that could have been done after actually I was put in detention, because that has happened while I was in detention, and I got to be sexually abused, violated, and I feel like my rights were actually, you know, they were violated to the highest level of my dignity being lowered. So with that being said, I actually feel like some sort of health risks that could have been imposed on me. First and foremost, rape is a common activity in police cells. And as a trans woman, I was at high risk of being sexually violated than anyone else. And there could have been some sort of measures, precautionary measures, with that being said, put in place. There was some, I feel like if it was sort of availability of condoms and loops, although the police department sees that there's some sort of luxury, especially for trans women, it's one of the most saddening things. And I would like to actually that if this is an issue that could be put in some sort of seriousness, or could have been taken very serious so that it can actually be seen as one of the most human rights situations. So we have limited supplies of let me say what, condoms and loops. As I said before, that that actually is seen as luxuries, especially for trans women in detention. So prior having been sexually violated, I did not get any sort of medical treatment. And that was because I did not actually come out. But I feel like there could have been some sort of measures put in place because this is a trans woman. Can we actually follow there should have been some steps to actually ensure that this person is safe in the space where she is at that point in time, and get to actually maybe offer me some sort of some sort of treatment or counseling. That's what I was actually frustrated about in the first place after having been in detention. And it frustrated me a lot that I actually feel that the justice system does not really take care of our health needs as trans women. And that is one of the most gruesome things that I can actually think of. It's very frustrating to actually think of. And with that being said, I would actually like to say that there should be more hygiene. There should be very frequent health checks in prisons, because we're exposed to a whole lot of things that actually happen besides actually being at health risks in regard to being sexually violated. We have many diseases that actually spread around the prisons, and there's very little resources in prison cells. And this just one of the things that one of the most things that actually have to be dealt with the justice system and the health department as well.
Thank you, Tebogo. That's
And
really,
yeah.
sorry.
In closing, that's just my conclusion on that.
Thank you. Thank you for sharing your very personal experience, and also for all of the work that you're doing to try to ensure, better reforms and protections for other people in similar situations and facing risks in detention. Following on from that, we'll stay with Just Detention International South Africa and hear from our last speaker, Doreen Gowra, the Senior Program Officer, who, among many other responsibilities, trains corrections officers and supports survivors of sexual violence in detention. So she'll speak about JDI's work to address gender-based violence in detention. Please, Doreen, you have the floor.
Thank you so much, Trina, and thank you to UNODC and PRI for setting up this session and for the invitation to speak here today. So I'm representing our organization. I'm a senior program officer at Just Detention International South Africa, which is a health and human rights organization that seeks to address sexual abuse in all forms of detention. And as Trina has already said, my contribution today is going to be looking at how, different countries and different governments could look at addressing approach to addressing gender-based violence in prisons and other closed settings. In a lot of countries, what we believe is that is needed is legislative reform of sexual offences laws. Many countries need to amend their laws to acknowledge that men and queer people can be victims of rape and that women can be perpetrators of sexual abuse. Doing so awards historically excluded victims of sexual abuse access to recourse and legitimizes their issues. People who violate trans people, be it male, female, or gender non-conforming officials or incarcerated people, often get away with it because of the tacit belief that they cannot be violated or that they deserve to be violated because they dared to deviate from what is considered normal, as was the case, as you heard, with Deboho and many others. Similarly, with cis women who are abused by prison officials, including female officials, or by other female incarcerated people, they're also often dismissed or don't report at all because their violation is not considered a legitimate violation. Again, this is all embedded in misogyny and patriarchy, as we all know. Additionally, countries also need to update their definitions of the different forms of sexual abuse in a way that aligns with the basic tenets that differentiates sex from rape. There's often a conflation, an incorrect conflation of sexual identities and sexual orientation with rape, particularly when we're thinking about this in prisons. So we need to be looking at, raising awareness around what consent is, and that consent is something that needs to be freely and informedly given by an adult of sound mind for any sexual activity with any party of any gender, for it to constitute sex. Of course, the most ideal scenario would also include not only the repealing of anti-gay or anti-trans legislation in a lot of countries, but also ensure legal gender recognition of trans persons so as to better enable the development of policies for detention facilities to address sexual abuse and the appropriate assignment of correctional facilities of incarcerated people by the judiciary. But even if this doesn't happen, there are other ways to use existing laws, be they domestic or international, especially for countries that have ratified instruments like the Mandela Rules, the Bangkok Rules, the African Charter on Human and People's Rights, Maputo Protocol, and also the Convention Against Torture, for example, to ensure the protection from sexual abuse of all people deprived of their liberty. Once a person is deprived of their liberty, the government takes on the absolute responsibility to keep them safe, regardless of their gender or their sexual orientation. The criminalization of consensual same-sex coupling or trans and gender non-conforming identities means that when queer people are violated, and they're usually the ones targeted for violation, they are too afraid to report because they won't be assisted and might even be punished for being violated, because that will be interpreted as them breaking the law. Another thing that needs to be looked at in addressing gender-based violence in places of deprivation of liberty is addressing overcrowding, because doing so will also enable better risk assessment and classification of people when they enter facilities. Understanding the various vulnerabilities to various forms of abuse that different groups face helps ensure the safety of people in detention facilities. Where possible, separation of vulnerable people from general populations must be done, but only after consulting the person deprived of their liberty first. Wherever people wind up, it is the facility's responsibility to regularly check the safety and well-being of people deprived of their liberty in all sections, especially where vulnerable people are. It would greatly benefit governments to utilize guides such as the UNODC technical brief that has been mentioned before earlier, the technical brief on transgender people and health in prisons, as well as the mapping of good practices for the management of transgender persons, for instance. There should also be a prioritization of alternative forms of sentencing for a significant number of offenses and explore restorative justice options so as to reduce prison populations and ultimately the further traumatization of communities. Lastly, there needs to be an acknowledgement at all levels of government that sexual violence in prisons and other closed settings is happening, that it shouldn't happen, and that it's a human rights and public health issue that affects governments and communities, the ignoring of which undermines other efforts to address other national priority issues, such as HIV and gender-based violence, for example. Political will and shifting on mindsets are required. This also includes sensitization training of detention staff and policymakers on gender, sexuality, and how they differ from rape. There should be a commitment to zero tolerance policies that are not rooted in the marginalization of diverse sexual orientations, gender identities, and sex characteristics. For example, in South Africa, the Department of Correctional Services developed the policy to address the sexual abuse of inmates in DCS facilities. And as is the case in the South African Police Services, they've also developed the standard operating procedures on the management of LGBTIQ+ people deprived of their liberty in their respective facilities. States can also put in place easily accessible and gender-sensitive and gender-affirming support services for incarcerated people in order to create environments that enable survivors to come forward and report their abuse and access help. Thank you.
Thank you, Doreen. I apologize for my poor chairpersonship that we've gone over time, so we probably don't have time for any questions, unfortunately. But do feel free to send any burning questions directly to PRI or to UNODC, and we'd be happy to connect you with any of the speakers or to follow up going forward. So that concludes our program, and thank you again to all of the speakers and for sharing their knowledge and experience, and all the participants for taking your time in your very busy schedules this week. We hope you found some inspiration for your own work going forward. I won't list all of the co-sponsors again, but thank you all for your support for the important topic. And of course, to our hosts, UNODC, HIV/AIDS section, for bringing this discussion to the CCPCJ and for your ongoing engagement with civil society. PRI is very pleased to be the secretariat for the informal CSO group on health in prisons that aims to ensure that the voices of civil society organizations working with affected communities are included in intergovernmental processes. So there's more information on that on our website. If there are any civil society organizations joining the event, you're welcome to look it up under the health section and consider joining. So thank you and wish you a successful week at the CCPCJ.